how do implant brands such as Mentor, Nagor, Motiva differ? I think that is a really good question. I can imagine if I wanted implants, I would want to know that answer to that question too, because there are quite a lot of different makes of implants, and it can be a bit daunting. I've just been to the meeting, the BARPS meeting, and there's all these implant manufacturers there with their stands trying to say that they're the best, or why their implants so good. Um, do you know what I think they do differ, no question about it. They do differ, but I don't think personally, I don't think you need to worry too much about it as long as you go with one of the big reputable companies um, with a sort of track record. Um, well, I say that, but then Allergan had the thing, didn't they, recently? I mean, I think. Well, I'll tell you how they differ, but the main thing I'd like to say is that you're not going to notice by looking whether someone's got Nagor or Mentor or Motiva or a certain make of implant in. You can't tell by looking. So the look is not really going to look is not going to differ. The reason to choose a certain make is, for me, I I to be honest, I usually just use the make that I've been using for many years. I use Nagor implants because I've been using them for many years. I know the range. I know the catalog, so it's just easy for me. But I always say to people, I'm not tied to any manufacturer. So if you want a certain manufacturer, that's fine. As long as the hospital can get it, we can use that implant. So if you want a Mentor implant or whatever, we can use that implant. Um, the main ways they differ in the way they do their texturing. So there's obviously textured and smooth implants. So there's different texturing and different levels of texturing. And there used to be smooth and textured. Nowadays, what with ALCL, which seems to be associated with the texturing of the implants, they're bringing out new ranges which are sort of less textured. So they're not quite smooth, but they're not as rough as classical textured. um, um, Nano textured, they're called, sort of, they're just sort of slightly rough, trying to uh, be more like smooth implants. But a lot of companies now make these nano um, textured implants. They also, the other big way they differ is in the warranty. The warranty is different between different implants, and that is a minefield in itself. So they pretty much, most of them, I don't really know about Motiva. Motiva are a bit newer. Don't really know about Motiva that much. I know Mentor and Nagor, Polytech. Those are the ones that I'm familiar with. But the warranty, broadly speaking, is different between different companies. Most of them, certainly the ones that we tend to use commonly, have got a warranty against rupture, lifetime warranty against rupture. That's I won't say standard, but that's quite common. So you've got to be a bit careful if someone says, "Oh, these implants got lifetime warranty," you don't have to worry about it. It's absolutely fine, because that might just be a lifetime warranty against rupture, which rupture can happen, but it's less common than capsular contracture. So that's the other problem. So some implants will cover capsular contracture, or some warranties will cover capsular contracture, some won't, and some will maybe cover capsular contracture for a limited period of time. So that's the first thing you've got to look at in the warranty. The other thing with the warranty is some will cover you having the opposite implant changed. So if you have a problem with one implant, if you've had the implant, we've got this at the moment, you've got an implant who's been in 10, 15 years, and they say, "Oh yeah, we'll give you a new implant," you're going to be like, "Yeah, but I want them both changed because I don't want to have a 15. I'm not going to leave my 15-year-old implant in." So some will cover both implants, some won't. Some will cover a size change, some won't. Um, some will just give you the same implant that you've got. So, oh yeah, and some will give you money. Some will give you money towards the hospital costs, and some won't. So those are the differences in terms of warranty, um, and so basically warranty and texturing, I guess. So these nano textured ones have been brought in. Not sure how to feel about the nano texturing myself. Well, I do know how I feel about it. I mean, I think there's smooth and there's textured, and textured is better than smooth for certain reasons. capsular contracture, stability. Smooth is better than textured for some reasons, mainly ALCL. ALCL a lot less likely with smooth. So there's good things and bad things about both. They've made the nano texturing trying to make it a best of both. I think they're trying to imply it's going to be a best of both worlds, but it could also be thought of as a, worst of both worlds. If the texturing is good, then surely less texturing is less good. If the smooth is good, surely a bit rough is less good. So that makes sense. So I don't know about the nano texture thing, but that's what it is. So yeah, texturing might be different. The way they texture the implants can be different, but as I say, as a patient, I wouldn't worry about that. The way they make the implants might be different. So it's mainly the warranty and the texturing.